Okay, well, I'm pleased to be here. I'm Stephen Intille. I work at Northeastern. My office is within walking distance of here. And I was asked to talk about engagement as it relates to our project, our NIH project. So I'm going to give you my thoughts based on some experience that I've had with multiple projects. And my project, the network, is with Genevieve Dunton at USC. Some of the work I'll talk about here is also with my graduate student, Aditya Panada, and a variety of students in our labs. So the takeaway here on engagement is that there was this definition from the prior talk, a dynamic state of interest and energy directed toward a focal task or stimulus. And I'm going to give it a little bit more of a simplistic definition for my talk, which would be measurable, undeniable, sustained use, sufficient for an intended task without unsustainable or unscalable extrinsic incentives. And in particular, I'm going to focus on when the task is just measurement, because this is pretty tricky, and this is what we're doing in our observational study. The exciting promise here overall that I think everybody in the network is interested in is in using behavioral health and enhancing behavioral health research essentially by using ubiquitous sensing, the devices that we all carry with us that are in our homes, the type of stuff that Wendy was talking about earlier. But in particular, we want to use mobile phones and smartwatches to detect physical activity, sedentary behavior, sleep, social interaction, affect, stress, and more. And the idea is you take the quote-unquote breadcrumbs that come from using these digital devices to combine that with machine learning and then essentially simultaneously measure a variety of health behaviors so those become unsiloed essentially, find unexpected relationships between behavior and health outcomes, and then ultimately develop computational models of behavior and behavior change. And also important is just reducing measurement noise, because if we want to advance science, doing that is one of the best things that we can do. So for example, if we can measure in a very temporally dense way, we can just ask better questions. So in physical activity, we could say, are short bouts of physical activity as protective against disease as continuous long bouts? The more temporally dense I can get with that measurement, the better I can do. In terms of interventions, if we think about real-time interventions, if a system responds in real time to what someone is doing or is likely to do, if it understands their habits, that gives us all sorts of new opportunities. So we want really temporally dense measures, essentially. And my colleagues, I come from a background of computer science, my colleagues would like to do everything passively. And we think we can do a lot passively in things like physical activity. But we will need self-report, even to make the algorithms that do the passive work. We need self-report to measure things like eating and relationships and pain and mood and perceived exertion. We're going to need self-report to do that. So how do we get temporally dense self-report? Well, we have EMA, so a fancy name, ecological momentary assessment, for having your phone beep and ask you questions, right? So here's an example of the type of thing that we do. This has been around for a while, and it's valuable because you can be prompted in the middle of your everyday life. It might reduce recall bias, and it may actually also help us explain the missing passive sensor data. And examples of this are, here's some from various studies and projects I've worked on. How mad or angry were you feeling just before the phone went off? What were you doing just before the phone went off? Choose all that apply. Since the last survey you answered, have you had too many things to do? Those are examples of typical EMA questions. So the limitations could be cost, but not anymore, because people carry these devices on their own, buy them on their own. Reactivity might be an issue, but there's some evidence that for big behavior changes, this isn't going to be enough to get you to make those changes. Otherwise, we'd be done in many behavior change disciplines. But the interruption burden is a really serious issue, especially if you want to do intensive longitudinal data collection. So where's this come from? Where's the problem come from? Well, long questions, frequent question sets, device access, and the disruptiveness of the prompts. And that's going to can result in a perceived high burden and a lower study compliance. Now, we can get decent study compliance in some cases, but ultimately, we really want to reduce this interruption burden, but still achieve the high temporal density. So my experience is from a lot of studies with EMA, and I test my own software, so most of the time for the last years, I've been getting prompted by my software. We're testing things like measuring stress and asthma symptoms and asthma inhaler use, physical activity, diet and weight loss behavior, physical activity in wheelchair users, household sleep of children, mothers and children's health together as a dyad, and then in this most recent study, looking at micro-temporal processes underlying health behavior adoption and maintenance. So it's called the TIME study. And in all of these cases, is an example of where we used context-sensitive prompting. When an inhaler button was pressed and used, then 5 minutes later, a child would get a prompt on a phone asking them about the context in which they used the inhaler, or where the phone is measuring motion, either motion or a lack of motion, and then after an hour of that can prompt and ask questions about that situation, or sleep disturbances where somebody wore a wrist-worn monitor while they slept and had the phone next to them, and then in the morning it would ask them questions, say, last night around this time, 1:47 a.m., there was a sleep disturbance, and essentially what was happening to you at that time. So there's a lot of different ways that we can use this, including as dyads. So this is with my colleague Genevieve, a study where we were looking at children and their mothers. And so these were 8 to 12-year-old children, and both the mother and the child had a phone. And then there were 6 waves of this where they were asked questions in a typical EMA sort of study, where when the child and the mother could be together, so the weekends and then in the evenings, they could get prompted, and there was a schedule where they would get prompted roughly once every 2 hours, and then they would fill out a survey of about 20 questions, and overall we get decent compliance for the mothers, about 79%. And what that looks like is here a question over the last 2 hours, were you with your child? So we needed to know that, and then it would ask about things like stress and perceived stress, again, on questions on the phone that the mother and ultimately the child were answering in this case. Weight-related practices, and then also healthy eating and unhealthy eating practices. And we tried, in some cases, to have some questions only pop up some of the time to try to reduce the burden under the assumption that just having less questions would reduce the burden. So that study gave us confidence that we could do this, at least for a period of a week to 2 weeks, of asking questions roughly once every 2 hours in a fairly intensive way. And in the new study, we're trying to study the relationship between reflective and reactive practices as somebody goes between an adoption and a maintenance phase of trying to maintain a behavior like physical activity. And in this case, what we're hoping to do is we select factors of what we think might be important for informing a theory, and then we take machine learning and try to use that to identify other predictors that we might not consider, and then ultimately feed that into a more nomothetic type of model where we're trying to then figure out how do we make a model that's going to go across multiple people. So we want specific models for specific people based on their habits, and then we want to be able to generalize those models, and we want to try to use machine learning to do that. And the trick is the machine learning is data hungry. It wants a lot of data. So if we're interested in a particular behavior event, we need to know before that behavior event, and as much detail as possible, what happened before that event so that we can try to figure out how do we get an algorithm to predict this or a theory that explains this. So what we're doing is taking mobile phones and smartwatches. It's the mobile phone that people already have, so their personal mobile phone, and then a smartwatch that we're giving them. And we're asking them to wear these for a year and run our software for a year in 250 people where there's passive sensing and active self-report. And we're trying to get as much detailed data as we can, as temporally dense as we can. The phone is essentially, and the watch are measuring just about everything they can, but we also need self-report to get at many of these reflective factors. The passive data collection is then used as our measure of our outcome, ultimately, of physical activity, sedentary behavior, and sleep, and then looking for episodes of those and lapses in those. So that's essentially what we're doing in a nutshell with a study population of emerging adults who are often heavy phone users, who are recruited from both a cohort and just social media, and who want to engage, either already engage in or want to engage in physical activity. So this diagram essentially explains what's going on with the sensing, and I'm not going to go into all the details of what's happening here, other than there's this whole year period. These blue boxes are where they're getting intensive surveys on the phone once per hour. So we upped it from our prior study, hoping that we could get away with it. But I'll talk about that more in a second. And then end of the day surveys, and then in the middle here, it's passive sensing, a few context-sensitive questions, and then this what we'll call micro-EMA that I'll also explain a little bit. So what we're trying to do now, and we're in the piloting phase, so I don't have hard data right now. We're just trying to figure out how to make certain things work. But I'm going to mention our engagement strategies, what we're trying to do. So the first is pay for compliance. And we're paying people up to $100 a month based on their survey completion rate. Now remember, this is an observational study, so they don't get much out of it, really, and that's one of the challenges. The second thing we're doing is real-time remote monitorings with check-ins. So we can, on our software, we can look and see this is data for me for a day, and it's got battery life info and survey info. Basically everything that we record, I can see within about 4 hours of when it actually happens. And so that helps us with compliance, or monitoring compliance. We're also trying to target behaviors with context-sensitive prompting. So this is GPS data for me, and then what that we're working on is the clustering of this into locations, and then I help label those locations over time, which can change with semantic, meaningful labels that may then ultimately be able to be fed into models. We're running on the person's personal mobile phone, not a handout, which is what we've done often in the past. So they have an incentive to keep that with them and keep it charged. And we're permitting standard use of the watch because we essentially can't force them to use it in a certain way. We have to allow them to use it the way they're going to use it, both the phone and the watch. And that's good for them, but bad for us because it means that there's a lot less control over what's going on. Another strategy we're using is exploring what we call micro-interaction, and I'll take a side step here to explain what that is. So this is at-a-glance questions. And the idea here is when we're not getting the really intensive data from the mobile phone, what we call the burst periods, we still need to get some data, even just to help the algorithms understand what's going on with the person. And so this would be the type of thing where it's as quick as looking at your watch and being done with it. Okay? And we've done a little bit of piloting on this to try to see, can we make this work? These little 2-second interactions that don't disrupt you from whatever you're doing. So we have a smartwatch, which has a nice display and sensing features, but the real thing is that it's instantly accessible and it can give you these reliable tactile prompts. So the strategy here is pretty simple. In mobile EMA, you interrupt less and ask more, generally. That's often what people try to do to maintain compliance. In this case, we're going to do maybe a counterintuitive thing, which is to interrupt more and ask less. And in one pilot we did, despite about 8 times more interruption, the watch micro-EMA had higher response rates and study compliance than the mobile EMA for the same amount of data collected, essentially. And despite interruption rates as much as 8 times per hour, the watch micro-EMA was perceived as more tolerable than the mobile EMA. So it's a little bit counterintuitive. And then the question becomes, is the effect just due to the micro-interactions or the fact that it's on a smartwatch? Why don't I put the other surveys on the smartwatch? So we did a follow-up pilot for that, too, to see if we put the exact same questions on both the watch and the phone with sort of a scrolling interface so you can see all the questions and everything. And then we have the micro-EMA on the watch, which is a simpler question and simpler answers. Then what's going to happen in that case? And what we found in this pilot is that the micro-interaction-based EMA implemented on a smartwatch resulted in a higher study compliance than EMA on a smartphone or a smartwatch. So the difference is in the micro-EMA, about 81% compliance versus 64 and 59% compliance. And it's not because of the novelty of the smartwatch either. So the novelty is not sufficient to get that compliance. So we're exploring the use of micro-EMA as a way to gather additional very temporally dense data. Another strategy is reinforcing the value of the participants' efforts. And this is tricky because we don't want to modify their behavior, and we don't have an intervention. And so these are examples of ways we're trying to do this now. Essentially, we're trying to include content that is a little bit edgy or cheeky to sort of get at this. So one of these says this is just something they get randomly either during a survey or after a survey that they've completed. The brain uses over 1/4 of the oxygen used by the human body, probably even more when you're answering questions. Thank you. Okay, so if you've been answering questions like this over and over again, this will actually make you laugh. And that's really our goal, is to try to get some incentive by reinforcing the idea that we care about the data, even though they're not using the data. It's not directly relevant to them. It's only really relevant to the researchers. The same thing sort of happens on the watch, but in a simpler way. Along those lines, we're also trying to incorporate fun. And I put fun in quotes because there's a limit to how much fun we can have when we're asking them to contribute all this data for such a long period of time. But we're trying to figure out how do we use surprise, add diversity in terms of the questions. So we want questions simply because we want to get engagement, and to use creativity and edginess as well. And so again, here's another example of measurement fun. So sort of inserted in the standard psychology surveys, there's a type of jellyfish that lives forever. I hope it never signs up for a study where it has to answer so many questions, okay? In the middle of you answering some amount of questions. And these are examples of questions on the watch. Some of these are questions we care about because of the research questions we're interested in, and other ones are not, right? And so what we're trying to do here is make this less predictable. Because when it's predictable, it's boring. When it's unpredictable, it's more interesting. And we're trying to figure out, is this actually going to help us or hurt us? The last thing we want to do is reduce the question frequency, and that's really our last resort. And we're just starting to look at data that we're getting from our pilot. But so far, I'll tell you that the pilot participants much prefer the EMA, micro-EMA, even though they get the questions 4 times per hour, versus the phone questions, which in this case they were getting once per hour, but only for a 4-day stretch, and then it was over. And then we're looking at the data that we actually get as well. So this is data from the mobile phone of a variety of constructs, and you can see just by eyeballing it that there's 4 4-day burst periods in here, actually. You can see there's a little more variability at the beginning than at the end, and that's something that Arthur Stone and others have pointed out may be occurring, and this is the type of thing that everybody in the network is going to have to really explore very carefully with their data of what's going on with this self-report. So in sort of getting to the end here, going back to the beginning, in the prior talk, there's this idea of definition of affective. So do you like the task? Do you enjoy it? Do you feel attached and committed? So my take on this is the primary task doesn't necessarily need to meet this goal. For example, measurement in a research study like mine, but something must meet this goal. And we're trying to figure out how do we get that something without influencing the data that we're gathering. And we're exploring simple strategies to achieve this. In the prior talk, there was this idea of behavioral. Do you perform the task behaviorally? Do you go for a run or use the app? So my take is that for a longitudinal measurement study, again, measurement study, we need to focus on finding long-term sustainability strategies that do not require much compensation. And this might involve asking or interrupting more, not less, which again is sort of counterintuitive, perhaps. And then in the prior talk, there's this idea of cognitive. So do you spend time thinking about the task? Do you engage in cognitive processing? And my take is that for a longitudinal, again, measurement study, if the participant does this, they will likely want or need frequent and engaging validation from the app in some sense, even if we're not giving them back the exact data that they're giving us. So overall, my view is that it works. EMA can work in a short term, but paying people is not enough for high temporal density intensive longitudinal data collection. We're going to have to figure out better ways. And even in a measurement-only study, we must work harder on innovative ways to impact the affective cognitive component. Otherwise, the measurement's probably not going to be sustainable. And we need to limit cost to the participant, so that would be burden, time, interruption, and also mental effort of answering the questions, and offset that with fun, entertainment, surprise, and creativity in some manner. And doing all of this is going to mean relinquishing some standardization, and this is where the uh-oh is for researchers, because they don't like that. They don't like having some random question that might make somebody laugh in the middle of a set of questions where you're asking them about how they're feeling. And so this is the sort of pushback or boundary that we're sort of hitting up against where we're trying to figure out how to do this sort of work. So I think there's a lot to be done, and we're not doing questions now. We'll do questions later. But I thank you for your attention, and I'm happy to answer questions later.